Hello, Sanjeev. Tell me a little bit about yourself and My Health UK, which you created.
Hi, Veronica. Yes, I'm a GP. Been a GP for the last 12 years in Blackpool, and been developing a product which is called My Health UK over the past 2 years, which essentially is a digital platform created for primary care with a patient-facing app to activate patients.
And what sparked this development?
The main reason for looking to develop something like this is over the years, as working as a GP, there's been a lot of changes in primary care and a lot of difficulties in terms of addressing capacity. And My Health UK was designed to help to address those needs in primary care by giving clinicians a platform to engage with patients, but at the same time, activating patients to encourage self-care, to help address some of the challenges facing primary care, which is capacity and demand.
So, are there any other digital solutions other than My Health UK?
Yes, they are. They are digital platforms that have been adopted in primary care, but we still are faced with the same challenges addressing capacity and demand.
And so, does My Health UK address those challenges? Tell me more about the ins and outs of your approach.
I think one of the key things for developing a digital platform was not to duplicate services that are already in existence. So we created a very modular platform that addresses needs that are currently facing primary care. And firstly, to activate patients, to encourage self-care. The second big challenge is to help address capacity. And the way we've done that is by helping to reduce DNAs, by providing new modes of consultation so patients can access, giving clinicians the opportunity to manage patients more effectively through our remote monitoring solution. Take, for example, one of the platforms we created, which is community care. At present, we call it the home visit challenge. GPs spend a lot of time having to visit patients in care homes and nursing homes, and we've created a unique solution to help address that, where clinicians can safely manage patients and reduce the number of home visits and spend more time in clinical care.
Walk me through an example. If I was a GP and I was looking after someone in a care home, how would I use My Health UK with that patient?
I mean, talking about our community care model, which is one aspect of what our solution provides, we've created the solution to give clinicians control over which patients they want to monitor in the community. So, for example, if I have a patient in a particular care setting that's a high demand patient requiring a lot of home visits, I could enable that patient to be monitored remotely in the care home by selecting a set of vitals that are appropriate to that patient. If the care staff then needed an assessment of that patient, they would be able to submit me the vitals, including a secure message and also an image of the patient if needed, if it was appropriate, for the clinician then to review that on My Health UK platform, make an informed decision, communicate back to the care home with advice and a treatment plan, but also giving the care home more information about the patient that would help improve the care. So the clinician can submit a care plan, can submit a discharge summary, any relevant information they feel may help improve the care of that patient in the care setting. And hopefully, by doing that, reduce the number of unnecessary home visits.
Sanjeev, that sounds amazing. It sounds like something which the NHS needs in order to transform itself. Have you come across any barriers or challenges facing the adoption of My Health UK?
As a clinician, creating a product without giving a thought about how we're going to roll out and move forward. They are, I think you're always faced with challenges. I think the biggest challenge with any clinician developing a product is trying to get the message out as to what your product's about and getting an opportunity to trial it in even a small setting. And that takes a lot of time and effort and resources to be able to achieve that. The other barrier, I think, in the NHS is to adopting technology is the concern about the cost of using new technology. And that is one of the main things I've focused on, to create a cost-effective solution that encompasses a lot of technologies into one product, but making it so that it's a modular system that can be adopted independently depending on where the need was. And as I gave you the example, looking at the community care model to help address the home visit challenge for GPs, it's a standalone product within My Health UK that can be adopted on its own without any of the other features that the product has to offer. And I think the NHS has to look at solutions like that to transform the way it currently adopts technology and to become more sustainable in the future.
So tell me about the adoption of My Health UK locally and what your vision is for more national adoption.
We've been fortunate. It's been commissioned by Blackpool CCG. So we have rolled out to practices in Blackpool. We've also been fortunate to be part of a INR remote monitoring project in East Lancashire. And that started in June of this year. So that's where we're up to at this stage. The next opportunity for me would hopefully, I would like to see My Health UK adopted maybe at a wider local level, say Lancashire, in the near future. At the moment, we are collecting a lot of data and evidence to show how the product is being used at practice level and to obviously show benefit.
The 5-year forward view from the NHS has suggested a number of high impact areas which it needs addressing. Can you tell me how My Health UK addresses this challenge?
My Health UK uses a lot of technologies brought into one platform to help address some of these high impact actions. And for example, if you look at patients, a lot of focus is on activating patients, encouraging self-care, social prescribing, and signposting patients appropriately to the right health information and resources at local level. We have solutions and technologies built into our product that can achieve that at practice level, but more importantly, looking at working in collaboration with other organizations like the CCG and the local council. We can offer our platform for these organizations to engage with the public and help to conveniently signpost patients to the right resources that are available at local level. Our product is also able to target patients based on their health profile to activate patients and encourage self-care. And that's the model we're looking at currently to roll out with Blackpool CCG and Blackpool Council.
And tell me a little more about how your product helps increase productivity for staff.
One of the key things about My Health UK is its integration with EMIS. And we've provided, for the first time, a very unique opportunity for practices to engage with patients by targeting patients that need to be seen by primary care. We've created an automated recall system to invite patients that need health checks and reviews. More importantly, we've also given practice staff the opportunity to recall and invite patients for any workflow or task events generated by clinicians. Currently, the way practices achieve that is by trying to ring a patient or send out letters. Without EMIS integration, this service is sent automatically to patients, and patients do not have to ring the surgery to book the appointment with the appropriate clinician, and giving patients the opportunity with just not a face-to-face consultation, but allowing them to book a telephone consultation with a clinician if appropriate. Our solution also sends automatic reminders to patients on all appointments 2 days before it's due, giving them an opportunity to confirm or cancel the appointment and help reducing DNAs.
So it sounds to me that My Health UK actually enables staff to work smarter.
As a clinician, I can say, and looking at how my other colleagues work, we work very hard. Practice staff are constantly on the phone dealing with patients. And to address the workforce crisis, I think we need to work smarter and to be able to communicate with patients in a more effective way. And that's what My Health UK has been able to achieve. With our unique EMIS integration, we've been able to provide practices with the solution to do just that.
We know that the NHS is under a lot of pressure. We know that it needs to transform to survive. It seems to me that you, as a working clinician, have developed something which could really make a valuable contribution.
Veronica, with the current workforce crisis we have and the difficulty in recruiting clinicians, nurses, and practice staff, I feel we have to transform. We have to work smarter. And a cost-effective way of doing that is adopting technologies that's able to achieve and give clinicians and practice staff the opportunity to have productive workflows, to be able to communicate with patients more effectively. Because as a clinician, I spend a lot of time sometimes seeing patients when I could quite easily manage this patient remotely, which I've had the opportunity to do. For example, seeing a patient with hypertension, starting them on a treatment, and managing the condition remotely using My Health UK. And that has saved the patient a lot of time having to book appointments with either the nurse or myself, and also given me the opportunity to manage this patient more conveniently. I could deal with patients where there was more urgent need.